Hey everybody, welcome back to our Facebook Lives where we're going to be talking about chiropractic topics, and today we're going to be talking about a particular type of condition. Now this condition is called Meniere's disease, and I'll be going through what this disease is, what this cause of this disease is, what the symptoms are, and some of the things that you can do to help to solve it. So Meniere's disease is again named after, of course, the discoverer, the first person who was dealing with this kind of condition. Meniere's disease is a condition where people will experience vertigo usually, they'll have some dizziness or feelings of giddiness, have some problems with balance, there will also be some vomiting, some nausea, some other issues going around with the stomach, and predominantly though there's also going to be, as well as the dizziness, issues with the hearing and issues with the ear in general, such as ringing, such as fullness of the ear as well. Now when all of these things start to accumulate together, there is a potential that it can look like a few different types of diagnoses. It may look very similar to BPPV, labyrinthitis, or what could be considered as maybe a vestibular problem or generic vertigo for an unknown cause. However, when it's Meniere's, it's very clear that it is something more to do with an inner ear problem. I won't go too much into the details, but this is usually when there's an imbalance within the endolymph within the inner ear itself. And this is where essentially you have these parts in the middle part of your ear, in the inner ear, which are helping to make sure that you can maintain balance and that your balance is not going to be affected, say, when you're moving your head. And it also helps you to know when, say, you are standing up or when you are lying down or when you're upside down without having to have your eyes open. You know, for all of us, if we were upside down, we'll be able to feel the difference. And part of that is due to the liquid that's contained in that part of the inner ear, in the middle part of the head, which is then going to be putting stimulation onto these small parts and letting you know how the body is positioned. However, if there is a change in the amount of this liquid, say the pressure is too much or too little, it's then going to start to affect those balance centers, which can start to throw off other nerve endings and affect things like the stomach issues as well. When this is affected, because again it is in the inner ear and it is so close to that part of the ear, it may start to feel like this feeling of fullness or like water is behind the ear, and it can start to affect the hearing, either by causing ringing or even by causing a loss in hearing. Now here in our practice we see a lot of patients with Meniere's disease, and for a lot of them the residual thing really is going to be that problem with hearing, whether it's a hearing loss, ringing, or fullness of the ear, or a mix of all three together. And usually there are points where it can be made worse or made better depending on what a person is doing. So if a person, say, is having their head in a certain position, they may notice it makes things better or worse. If they sleep in a certain way, if they're more stressed, they don't get enough rest, all of these potentially can be triggers, as well as too much salt in the diet, or maybe certain other types of food, or for some people, even something like being in the sun or coffee. So really there is a lot of potential triggers, with salt in diet really being one of the big ones. Now, of course, what you may be wondering is, why do people get this? And of course, what they can do to help to solve these kind of problems. So one of the reasons that people get this potentially is if there is, say, some sort of chemical imbalance, if there is some sort of bacterial problem. However, if that happens, especially if it's bacterial or viral, as some sort of virus or some sort of bacteria affecting them, usually it's more likely to cause something like, say, labyrinthitis, which is much more aggressive when it first starts, and there may be a lot of vomiting, a lot of nausea, not being able to move and almost being incapacitated. Whereas with Meniere's, one of the big differences is such the big effect that there will be on the hearing, and how there can be this progressive build-up as well as these localized attacks when it does happen. In terms of the reason why it does happen, a lot of the current research is pointing to is there is this disruption within the nerve system. So the nerve system, the part of your body which is like a wiring system supplying all the information between the brain and every single part of the body, can be disrupted by certain things. Whether it's due to, again, things like bacterial changes, whether it's inflammation in the body, or if there's a misalignments in certain parts of the nerve system, or especially in the spine, which would then affect the central nervous system. If those nerves are affected, those wires of the body can then start to be inhibited going to certain parts of the body, such as your inner ear. So as an example, at the top part of the neck up here, we have the brainstem, and it has some of the main control and relay centers that go to your inner ear, all around the ear, as well as all around the face as well. It's part of what we call the cranial nerves. And if those cranial nerves are affected, it means that the inner ear may not be able to keep the liquid levels controlled properly as it should be. If you think of it a bit like, say, a dam, a dam, a water dam, is going to have water at different heights on both sides, and it's maintaining that pressure to make sure the water can flow through, whether it's for cleaning or anything else. But for your body has to maintain these pressures. But if there's a problem with the information coming in and the information going out, it may not be able to maintain things properly. And if it can't maintain things, that's where it could start to cause this feeling of dizziness for yourself, starting to affect the nausea, and of course affecting what's happening with the ear as well. So one of the big questions, of course, is what is causing this disruption in the nerve system? And the Berkman Institute has shown that there is a lot of research that indicates that an issue happening in the top part of the neck, specifically the top two bones we call C1 and C2, or the atlas and the axis, that when they are misaligned, they will start to interfere with the normal workings of that top area, that control center, the brain center, so the brain stem. And that brain stem is then going to be interfered with and not send the right information to the inner ear. And of course, then it starts to lead to, as we talked about, some of these other symptoms as well. So in our practice, it's actually something we see quite a lot of. We see a lot of patients with Meniere's issues. And when we do see them, we do find that there is generally much more of a likelihood of there being some sort of issue with the nervous system that we can see on our nerve scans. And then we take x-rays, we can see some level of misalignment happening at that top level. For these cases, usually chiropractic care is very effective, as well as, of course, going through some of the other triggers for them and avoiding certain things, such as, again, salty foods or stressful events, things that may be more of a disruption for that person. So for all of these cases, we do usually get quite good results when it comes to those changes, especially when it talks about those changes in hearing and balance as well. Usually it's always best though to make sure that you've gone to an ENT first or seen a medical doctor, just to exclude any other bigger things, any other potential diagnoses. If anyone has any questions about this, Meniere's, or our approach, feel free to give us a call on 8438-9550. Of course, you can comment on the video below, or you can send us an email at help@vitalitychiropracticcenters.com, and we'll be happy to get back to you and see if this may be something we can help you with. Yeah. Have a great evening, everyone.